Good morning. Thank you for allowing me to speak to the council today. I do not consent to this medical treatment. This water contains hydrofluorosilicic acid. It is not calcium fluoride, the naturally occurring fluoride found in nature that makes up more than 12% of the Earth's crust. This is a different chemical. It is a byproduct of the production of chemical fertilizer. This toxic waste is expensive to dispose of. Chem Waste in Christchurch charges $1,000 a barrel to dispose of hydrofluorosilicic acid. Industries have a pollution solution. They don't have to pay to dispose of it because they sell it to you. According to water.org.nz, the governing body of water professionals in New Zealand, hydrofluorosilicic acid has MAVs, maximum acceptable values, of lead, cadmium, arsenic, mercury, and uranium. That's what's in this. I choose not to take medications like this because I am sensitive. I have fluorosis, fluoride poisoning, due to a fluoride overdose when I was a child. That's why my teeth are discolored. I also have a neurological condition that is aggravated by the ingestion of fluoride and the other toxic metals found in this glass. This causes me medical harm. I do not consent to this medical treatment. This is the only medication delivered this way. It's not a pharmaceutical regulated by the Medicines Act, subject to the same safety standards. But we're only told it's one of the best public interventions in health in the world. Which is odd because it's not very popular. Out of 193 countries in the world, only 25 fluoridate their water supply. Out of the world's 193 countries, only 8 fluoridate more than half of their population. For being one of the world's best public health interventions, a lot of countries don't do it. New Zealand is in the minority in this case. Now, when my doctor recommends that I take a medical intervention, I ask questions about the possible side effects and how it could affect my health, for good and for bad. In all other situations, with any other medication, I can give my informed consent or I can withhold it. My body, my choice. No individual doctor can force me to take a medication against my will. But Dr. Sarfati, the Director General of Health in New Zealand, claims that she can. So I want to ask her 5 questions as the doctor who is administering this medication. And I'd like you all to join me in asking her to have a public fluoride patient consultation, since we are all her patients. Please take one and pass it down. Thank you. We will read these 5 questions together.
Thank you, Caelan. Excuse me, we've got a couple more minutes left.
Yes, I'll be under 5 minutes.
Thank you.
When the time comes, at the appropriate time for the council, I'd like you to vote as a council to formally support my request. I'm asking for 30 minutes on Zoom with Dr. Sarfati, spending 5 minutes on each of these questions. Number 1, what is the risk-benefit analysis comparing dental benefits with potential harms? from bone cancer, thyroid disorders, and lowered IQ? Number 2, is there any surveillance in place to monitor cases of fluoride overdose? If not, why not? How many New Zealanders do you expect to suffer adverse health effects? Number 3, why do you advocate for internal ingestion of fluoride instead of topical application? Number 4, why are the rates of dental decay so similar in non-fluoridated areas? Number 5, is a decrease of 7 IQ points functionally significant or not? And then I get into details about the 2014 Royal Society report that the government relies on as their evidence for fluoridating the water supply. I list all the citations and links at the end of this document, and I ask you, as my local council, to formally support my request for this public fluoride patient consultation. Thank you for your time.
Thank you.
And thank you, Caelan, for the 5 questions, which I think it would be lovely, I think, for the whole country to have the Director General of Health answer those 5 perfectly reasonable questions, in my view. And I think that they have an obligation to actually give clear and considered evidence in response to the issues that you raise in those questions.